Welcome to The Explainer. Today we are demystifying a super common but, let's be honest, kind of anxiety-inducing hospital procedure, the IV cannula. And we're going to show you why understanding this little device is actually your ultimate guide to vessel health. Ever wondered what that little plastic tube in your arm actually does? Seriously, if you've ever laid in a hospital bed staring nervously at the back of your hand or the crook of your elbow wondering, how does this thing work and why does it ache a bit? You are absolutely not alone. It's completely natural to have some curiosity and, frankly, a bit of fear about a procedure like this. But you know what they say, knowledge is power, especially when it comes to your own body. Okay, let's jump right into our roadmap for today. We're breaking this down step by step. First, we'll meet your IV cannula. Then we'll look at how insertion actually works, decode all those different types and colors, see what actually goes in the tube, and finally, talk about how to care for your cannula. Section 1. Meet your IV cannula. The basics of access. So, to clear up some early anxiety here, let's establish the basic medical facts. An IV cannula is basically just a small, incredibly flexible, and resilient little tube. It gets inserted into a vein to give doctors and nurses direct, secure access to your bloodstream. The whole point of this brilliant little tool is to deliver fluids, blood, or medications without having to poke you with a sharp needle every single time you need a dose. It is literally designed for your comfort and safety over a longer stay. And hey, if you ever feel singled out when they roll up with the IV cart, don't. To put it into perspective, a massive 80% of hospitalized patients require IV access at some stage of their treatment. 80%. It's one of the most common medical procedures on the planet, used everywhere from tiny rural clinics to massive trauma centers. So getting an IV isn't the exception, it's practically the rule of modern medical care. Moving on to Section 2, how insertion actually works, the step-by-step process. Okay, a lot of the fear comes from just not knowing what's happening under your skin, right? So let's pull back the curtain and walk through the clinical steps. First, the nurse applies a tourniquet and carefully finds a good vein, usually looking for one they can feel, not just see. Second, the needle pierces the vein. The nurse is looking for a tiny flash of blood in the chamber, which basically tells them, bingo, we're in. But here's the clever part. The plastic catheter actually sits just slightly back on the needle. Once they see that flash, the nurse drops the angle so it's almost flat against your skin, advance it just a hair, and then smoothly slides the plastic catheter off the needle and right into the vein. Finally, step 4, that sharp metal needle is completely removed. I really want to emphasize this because this is a huge aha moment for so many people. The metal needle comes out. Only the soft, flexible plastic stays in your vein. No way are you walking around with a short piece of metal in your arm. That is exactly why you can bend your arm and move around without constant pain. The needle is just a temporary introducer, and it goes straight into the safe disposal bin once that soft plastic tube is secure. Section 3. Decoding types and colors. Gauge sizes explained. If you've ever looked closely at an IV tray, you've probably noticed those brightly colored plastic hubs. But before we decode the colors, we have to talk about the golden rule of gauge sizes. And honestly, it's completely counterintuitive. A lower gauge number actually means a larger cannula diameter, which allows for a higher fluid flow rate. Think of it like drinking straws. A low number, like a 14 gauge, is your giant, wide smoothie straw. A high number, like a 24 gauge, is your tiny, super narrow cocktail stirrer. So let's see how this translates into the universal color system used by medical staff worldwide. Up at the top, you've got those large 14-gauge orange and 16-gauge gray cannulas. Those are for trauma and major surgery, situations where a patient needs life-saving fluids fast. Next is green, 18-gauge, which is pretty standard for blood transfusions or prep for routine surgery. The pink 20-gauge, that's what most routine adult patients get for standard therapies. And finally, the tiny blue 22-gauge and yellow 24-gauge. These are perfect for small or fragile veins, so you'll see them used for elderly patients, kids, or even newborns. When your nurse picks a size, they are actively practicing vessel health. They're choosing the absolute smallest cannula possible to get the job done safely, which minimizes your discomfort. Section 4. What goes in the tube? Lifeline treatments. Once that device is successfully and securely taped down on your skin, what is it actually doing for you? Well,
This single, tiny tube is an absolute lifeline. It handles an incredibly wide variety of treatments. We're talking fluid therapy for rapid rehydration. It's a direct highway for antibiotics to fight infections and pain meds to keep you comfortable. It handles life-saving blood and blood product transfusions. It can even deliver parenteral nutrition, which is basically liquid food if your digestive system needs a rest. And in an emergency, it is absolutely the fastest way to resuscitate a patient. That one little tube does a ton of heavy lifting.
Section 5, Caring for your cannula. Vessel health. This section is all about patient empowerment. Your veins are a precious resource. And what's really fascinating here is the massive global shift in how hospitals manage IVs today. For decades, the old rule was routine replacement. Nurses literally had to pull out and replace your IV every 72 to 96 hours, no matter what. But the evidence just didn't back that up. So the new standard adopted globally is to replace the cannula only when clinically indicated. Basically, if it ain't broke, don't fix it. If it's working fine and there are no signs of a complication, it stays in. This single shift is saving patients millions of unnecessary painful needle sticks every single year. To quote the source material directly, replacing cannulas only when clinically indicated spares patients the discomfort of repeated needle sticks, preserves vessel health, and reduces the total number of punctures over a hospital stay. Honestly, it's a profound evidence-based game changer. It massively improves your comfort as a patient, saves your veins for any future medical needs, and saves healthcare systems immense amounts of time and resources. But keeping an IV in longer means we have to be active participants in our care. You really need to advocate for yourself. Keep an eye on your IV site and tell your nurse immediately if you notice any of these signs: redness, swelling, or pain. That could be phlebitis, which is an inflammation of the vein. If you see fluid leaking into the surrounding tissue, making it look kind of cool and puffy, that's infiltration. If you feel a sudden resistance or a sharp sting when the nurse flushes out the saline, definitely speak up. And of course, let them know for sure if the clear dressing gets loose or the ports look disconnected. Which brings us to the end of our explainer. I really want to leave you with this final empowering thought. Knowing your veins are a precious resource, how will you advocate for your own vessel health during your next hospital visit? The next time you see that sterile kit, just remember, it is not a metal needle staying in your arm. It's a flexible plastic lifeline. You know what the colors mean, you know why it's there, and most importantly, you know how to protect it. Thanks so much for joining me today, and keep learning.